Welcome to Chapter 5, Section 5.2, Oral Doses. We are going to be looking at using dosing tables for pediatric and also for elderly patients. The dosing tables include a range for age and then also for weight with corresponding doses. And these dosing tables are used for both oral liquids and solid dosage forms, but you're going to see the oral liquids used more for young patients, and so these are a lot more common, especially with over-the-counter drugs. Looking at dispensing the liquid medications, our other section that we'll be taking a look at. And keep in mind that oral medications are most often dosed by teaspoonful, tablespoonful, fluid ounce, and then in the metric system in milliliters. A lot of times when you are typing these prescriptions out, you may be using the milliliters. If it's not exactly clear if it's a full teaspoon or a half teaspoon, other times you will be using the full teaspoon or half teaspoon. So it's important to remember when you're dispensing these to give the patient an oral syringe, because the oral syringe is going to be marked with both household and metric units of measure, just to ensure ease of dosing. So if we turn our books to page 125, we're going to look at example 5.2.3, and this is going to be an example of figuring out the oral dose for prescription. The pharmacy receives a prescription for 100 milligrams of amoxicillin, and this is to be taken 3 times daily for 10 days. The pharmacy has a 150 ml bottle of 125 milligram per 5 ml, and it's 150 ml bottle. Okay, how many milliliters of the suspension will be dispensed, and what will the patient's dosing instructions on the label say? So it's actually a two-part question. First, we want to find how many milliliters, so we know that that's what we're going to be solving for first, and then the instructions. And that's going to be part 2. So looking at the information, we know we're going to be looking at the variable. We're going to be solving for X for milliliters. The desired dose is 100 milligrams. So we know as we set up our proportion that we're going to have mLs over here and milligrams on the bottom, because we want to have this matching units of measurement. And the available dose in the pharmacy is 5 mL for 125 milligrams. So now we have our proportion properly set up. We can solve for X. The 100s are going to cancel themselves out. The milligrams are going to cancel themselves out. And we can rewrite it just to make it a little bit clearer. And we're going to take 500 divided by 125, and X is going to equal 4 ml. So we've answered the first part of the question. Now we need to figure out what the patient's dosing instructions on the label are going to say. We know how much they're going to be dispensed, but they're going to be taking this 3 times a day. So it's going to read, take 4 ml by mouth, TID, for 10 days. 4 mLs 3 times a day, 4 times 3, that's going to be 12 ml. And if they're taking it for 10 days, times 10, that's going to be 120 milliliters. So you can see it comes in a 150 ml bottle. That will be plenty of medication for the patient. Let's turn now to page 132 and look at the problem set. And we're going to look at a dosing table, and we're going to figure out the dosing range. Okay, if we look at number 5, we're going to be looking at a dosing table for levothyroxine. Levothyroxine is indicated for children with hypothyroidism. Many states require infants to be tested for hypothyroidism shortly after birth, so that therapy can begin immediately if needed. In adult patients, the dose is adjusted up or down based on blood titers and clinical signs and symptoms. Newborn patients are more difficult to assess, so a standard dosing table based on kilograms has been developed. Determine the daily dose of levothyroxine for each child in the following questions using the dosing table provided. So number 5, we're working with a 6-pound newborn. So according to the dosing table, we're looking at the age. The daily dose per kilogram is between 2.4 milligrams and 6 milligrams. So the first thing we're looking at is that they are 6 pounds. We need to figure out what that is in kilograms. So setting that up, and this is just the dimensional analysis method. You can do it as a proportion if you prefer. And x is going to equal 6 divided by 2.2, and x is going to equal 2.73 kilograms. So now that we know how much they weigh in kilograms, the dosing range is between 2.4 and 6 milligrams. We want to find out what both the high and the low and the high range. So we're going to take the weight that we have calculated and take that times the lower range, 2.4 milligrams. And that comes out to 6.55. But we're actually going to round that up to 6.6. Okay, so now we're going to do the same thing. 2.73 kilograms times the higher dose, and that comes out to 16.38. So we're going to round that up to 16.4. So now we've got our dosing range. 6.6 to 16.4 milligrams. And if we look, the normal range for that age is 7.5 to 30. So we can see that our dose is well within that range, so that it is a safe dose for that patient's age and weight. And the important thing to remember when you're doing this is that you need to calculate both the low and the high range. So let's do one more together. Let's look at number 7. This patient is 23 pounds and they are 11 months old. So according to that chart, they're going to fall into the second category, the 6 to 12 month age range. And first thing we want to do is calculate the weight into kilograms. And that's going to work out to 10.45 kilograms. So if we look at the table, the daily dose range for that age is between 3.6 and 4.8. So we're going to want to find out the dosing range for each of those. So looking at the weight, 1045 times 3.6. I'm going to just erase that so we got a little bit more room. That works out to 37.6 milligrams. And then we're going to do the same for the higher dose. And that comes out to 50.16 milligrams. And we're going to just round that up to 50.2. So our range is 37.6 milligrams to 50.2 milligrams. Now, if we look at the dosing table, we'll see that their normal daily range is 30 to 45. So we'll see that ours is a little bit higher. So that's really going to be too high of a dose for a patient.